Good evening and welcome to Doctors on Call. I'm Dr. Alan Johns from the Department of Family Medicine and Community Health at the University of Minnesota Medical School Duluth. Tonight we're going to talk about cancer and take your questions about its prevention, diagnosis, treatment, and potential complications. What would you like to know? Please call the numbers on your screen. Locally, dial 218-788-2844 or call toll-free at 1-877-307-8762. I'm pleased to welcome our panelists this evening. Dr. Ann Silva, an oncologist with St. Luke's Oncology and Hematology Associates in Duluth. Dr. Peter Kebbekus, an oncologist with Essentia Health Cancer Center in Duluth. And Dr. Emily Onello, a family physician with the Lake Superior Community Health Center in Duluth and faculty member in the Department of Family Medicine and Community Health at the Medical School in Duluth. Our medical students answering phones tonight are Emily Sealing of Alexandria, Minnesota, Sarah Vernig from Onamia, Minnesota, and Cammie Young from Vernon Center, Minnesota. And now on to tonight's program on cancer. Well, Dr. Silva, you have a subspecialty in hematology and oncology. Could you maybe mention a little bit about what does a hematologist oncologist do? Do they diagnose patients or treat them? Or?
Yes, we are specialists in seeing all cancer patients, and including benign blood disorders as well. And we do diagnose. We do help diagnose patients with malignancies or cancer, and also we treat patients who are diagnosed with cancer as well. So we do a lot of broad-based treatment, management, and diagnosis.
Right, and you don't do surgery though, is that correct?
We do not do surgery.
Okay.
And yeah, there are the patients who do need surgery will go to surgeons, and there are special surgical oncologists as well for certain cancers.
Interesting, okay. Dr. Kebbekus, so let's start up by well, what is cancer? I mean, that's probably not a real simple question, but we'll let you take a stab at it.
It's a simple question. The answer may not be very simple. Essentially, cancer is a disease of the genes inside our cells where the cells have forgot how to behave themselves. So they forget how to die appropriately, and they will overgrow. They no longer respond appropriately to signals inside the body. And they also figure out how to evade the immune system. And these cells can grow large enough to cause tumors, and then subsequent complications after that. You can get cancer from any tissue in the body, from skin cancers, brain cancers, and we'll, I'm sure, get a few phone calls on a variety of different places that people can get cancer.
Thank you. Well, Dr. Onello, you are a family physician and you certainly diagnose cancers. What do people come in with? What are their symptoms they come in with who may have cancer?
I think relating to what you were saying, Dr. Kebbekus, about cancer being able to start in any tissue of the body, a lot of times the symptomatology or what a patient may notice would relate to the type of cancer or the location. So though you hear in broad strokes symptoms of cancer can be broad things like fatigue, shortness of breath, for example, if you have a problem in the lung tissue, easy bruising if you have a problem with the blood cells. Sometimes if there's a cancer in the abdominal cavity, a person might feel full prematurely even though they've only eaten a small amount. For example, a cancer of the kidney may show up simply as blood in the urine and be fairly painless. And I think that that's another point, is that I'm sure my colleagues would agree that many times cancer can be without any symptoms. Sometimes fevers, pain. So it's really quite a broad range, and of course those symptoms do overlap with other disorders. So it can be tricky to answer that question briefly, but it presents in many ways.
Thank you. Well, Dr. Silva, are all cancers bad ones? I mean, are there some, I don't want to say good cancers, but some less harmful than others?
There are some that grow slower than others, and when we, for example, chronic lymphocytic leukemia is a type of leukemia that grows very slowly, and we call it indolent type of leukemia. And some lymphomas grow very slowly as well, and patients live a long time without any symptoms, and they get diagnosed with for a simple blood test that they did at the primary care office for some other reason. And so there are cancers that are slow growing and what we call indolent.
Okay, thank you. That kind of leads into another question I had, Dr. Kebbekus. Are there blood tests for cancer? I know some of my patients come in and say, I want a blood test to make sure I don't have cancer. Is there such a thing?
The most famous one is the PSA, looking for prostate cancer. The PSA protein itself is an enzyme that's made in the prostate gland and in no other place in the body, so that high levels of PSA in the blood are generally indicative of cancer. But for others, certainly the blood tests looking for blood cancers, we do those. But there's no blood test for breast cancer or lung cancer or any of the other common sorts of cancers. You can see hints that people have more advanced forms of cancer from what we call accidental blood tests that were drawn for something else, and it's noticed that the platelet count is low. It's one of the kinds of cells in the blood, and then we start looking for why, and we discover a cancer.
Mm-hmm. Dr. Onello, are there certain screening tests that can be done to try to pick up cancer at very early stages or before it even manifests itself?
Well, I think that's a great question, and
like how do we prevent it, I guess?
Yeah, that's certainly
also
a great question, and in my mind what I do in clinic is trying to detect something very early when it is in a more curable state. And those would include the tests that many patients are familiar with. The mammogram is designed as a screening test for early breast cancers. You mentioned the controversial PSA test, the colonoscopy procedure designed to look in the colon for cancer or even precancerous growths. So yes, there are quite a few screening tests, and I think the challenge has been making sure that everyone in our population has access to those screening tests, knows that they're out there, and is able to get them because they have been shown to improve our health.
Great, thank you. We have a caller from Hayward and Dr. Silva who would like to know, there's a family history of pancreatic cancer. Is that can that be hereditary? And how do you test for that?
There are certain hereditary disorders that can lead to pancreatic cancer. Some of them are, for example, if you have the BRCA1 or 2 gene, these are genes that we see in patients who have hereditary breast cancer or ovarian cancer. And those patients are at a higher risk than others of developing pancreatic cancer. And if you have family members who had first-degree family members, which are parents, and brother, sister, if they had breast or pancreatic cancer, they are much more prone to get pancreatic cancer. There are certain disorders or hereditary disorders that predispose patients to get pancreatic cancer.
Here's a call, Dr. Kebbekus, here's a caller from Mason, Wisconsin. A friend of hers has cancer and is experiencing chemo brain. Can you explain this? It seems to affect her memory.
It can, the so-called chemo brain. This describes a phenomenon when people are getting chemotherapy, that just the way that they can think, the way that they can reason, their level of alertness, staying awake when you're driving a car or watching television or something like that, that it can be altered. And that's a known side effect of certain chemotherapy regimens. Often that gets better if this is a patient who's getting treated for a fixed duration of chemotherapy. We nurse them through it, and often that side effect will go away. In patients who are being treated for cancers in the brain, they get radiation as well. That's an even more potent effect on how well people think, is when they have to get radiation to the brain.
Thank you. Dr. Onello, a caller from Grand Rapids, would like to know, what are the tests for bladder cancer? There are certain tests that are done.
That is a good question. My colleagues can correct me, but I'm not aware of any screening tests for bladder cancer. I think the approach that at least I would take is if anyone has anything unusual, particularly blood in their urine or symptoms, that would prompt one to look very aggressively, and by that I mean looking inside the bladder with a scope, with an instrument, to make sure there's no visible cancer. Sometimes the cells in the urine can be analyzed to see if they're malignant. So I think the answer is if you identify that you or a family member may be at risk of bladder cancer, certainly you may want to talk to your physician about it. We don't routinely do any tests screening for it. But interestingly, oftentimes with the traditional general physical, we do check a urine analysis, and sometimes under the microscope we may see early signs of a bladder cancer. So sometimes, just as someone else mentioned here earlier, I can't recall who, that we find things when we're looking for something else.
Thank you.
Yeah, I would say anyone who is a smoker and is noticing blood in the urine, you should talk with your doctor, since bladder cancer is one of the cancers of smoking.
Sure. What are the other cancers of smoking, as long as we're on the subject?
So you can think of the cancers of smoking as pretty much anywhere that the smoke is going to touch. So everywhere from the lips, tongue, all the way down into the lungs. We also can see an increased risk of cancer in the kidneys, the bladder. Stomach cancers can be a little higher in smokers, and pancreas. Interestingly, the one that's not increased is breast cancer. That's about even amongst smokers.
Interesting. Thank you. Dr. Silva, a caller from Ashland, would like to know, what causes the body to overproduce white blood cells, and is that considered a cancer if you have overproduction of white cells?
There are certain non-cancerous conditions that can increase your production of white blood cells, such as if you are stressed, that can increase your white blood cells. If you're on steroids, that can increase your white blood cells. Infection can do it as well. Those are the main ones, the medications, infection, just being stressed, the body being stressed can increase your white blood cells without any underlying cancer.
Thank you. Dr. Kebbekus, a caller from Duluth would like to know, if he's had pancreatitis, does that increase your risk of getting pancreatic cancer later?
It can. It's not a strong predisposition, but it can increase the risk.
Thank you. Dr. Onello, we have a smoker with a chronic cough. Is that over the age of 60? Could that be cancer or lead to cancer, as a caller from Cromwell?
Yeah, I think that's a really difficult
Hard
question. Many of my patients who smoke will report a cough. They'll say, oh, it's just my smoker's cough, and I think that's really difficult. I would advise anyone listening and watching that if you are a smoker or even a non-smoker and you develop a persistent cough, you should have it checked out with your physician and consider having a chest x-ray. That would be my advice. I think certainly the risk factor goes up with age and the amount and intensity which the person smoked cigarettes. It's also important to remember that non-smokers get lung cancer as well. So that's why my advice would be for anyone with an unexplained cough.
Thank you. I'm going to ask a question that any three of you can pick up if you would like. What about using CT scans to screen for lung cancer in smokers? That seems to be more of a hot topic again.
Yeah, the recommendation right now of the American Cancer Society is that, so they did studies on patients screening with low-dose CT, chest CTs, versus X-rays. And they did note that they did pick up early lung cancer in patients who have smoked longer periods of time. For example, who smoked 1 pack per day for 30 years
Okay.
or more
Or
are at a
more.
higher risk, and those are the ones that they recommend screening with low-dose CT scans, chest CT scans, and they did note a reduction of mortality, some benefit with
Sure.
that.
Well, Dr. Kebbekus, why don't we just get a CT on everyone then?
That's a great question, and this is always one of the challenges when I'm talking with a patient and their family in the room, is how do we take population screening numbers and relate it to the person in front of us. When we talk about a screening test, we have to talk about populations, be it the people of Duluth, the people of Minnesota, the people of the United States, and ask some hard questions about, if we are doing CT scans on everybody from head to toe, are we going to find enough cancers that we can intervene on and make a difference and have that be cost effective? Right now, the answer to that is no. That would be an excessive number of CTs. There's some hints in the literature that too many CTs can increase your risk of actually getting cancer. So I would say someone who is in good health, go out and celebrate the fact that you're in good health and don't worry about having cancer. It's a challenge of knowing when to apply the screening tests.
Thank you. Dr. Onello, a caller from Superior, has platelets of 8 to 10, I assume 8 to 10,000, which is really low. Normal is 150,000. Is that a sign of cancer, having low platelets alone?
You know, that's a laboratory value, and it's sometimes hard to interpret by itself, but certainly concerning. I think it could be a sign of cancer. I think at that low a level that's profoundly decreased, that would certainly be a major concern of that, and something that a family physician, I think, would engage with my colleagues here to
Sure.
figure out. But I think there may be other things, viral infections, that can cause low platelet counts, and there's probably a longer list, but certainly that would be one of the top concerns with them being that low.
Thank
Would you agree with that?
Yes, it should be checked
Yeah,
out.
it all depends on what the rest of the blood counts look like, and it could be an autoimmune phenomenon.
Right.
But that person certainly would need to have further testing done
Yep,
Yes.
to make sure it isn't that.
correct.
Dr. Silva, a caller from Duluth, had breast cancer and underwent a lot of radiation. Can that cause other medical problems?
It can. It can lead to, for example, it can scar the lung with the radiation, because the lung is right behind the area of the breast, and also it can cause damage to the heart somewhat. And so we watch patients who've received radiation in terms of developing heart failure and such. And on top of that, if they received chemotherapy, that affects the heart, that also adds to it in terms of toxicity. And also certain lymphomas. You can get lymphomas with the exposure to radiation, especially if they receive radiation when they are young.
Thank you. Dr. Kebbekus, a caller from Lake Nebagaman, wants to know, are there any cures for pancreatic cancer? We get a lot of pancreatic cancer questions, and unfortunately it's fairly common and very difficult to treat.
So I put pancreatic cancer in what I call my rogues gallery of cancers, meaning it is not a good cancer to have, and that's because it's very difficult to treat, very difficult to cure. The only stage 1 or earliest, smallest stages of pancreas cancer that I've seen was a patient who fell off her treadmill and got a CT scan because they thought that she had injured her spleen and found a very small tumor. And I saw her about 8 years after that, and she was cancer-free. Unfortunately, there's no other screening test for pancreas cancer, and by the time it causes pain or other symptoms, it's usually too big to remove.
Thank you.
So it can be cured, but only by surgery.
Dr. Onello, a caller from Superior, her husband has a tumor on his pituitary gland. Is that considered a cancer?
Well, this is a great point. I'm glad the caller raised this question, because we use the term tumor to imply sort of a growth, a globule of something. It doesn't always mean that it is a cancer. Sometimes it's in a strategic location where it may cause a symptom, and certainly the pituitary gland, being a gland within the brain and the skull cavity, is what I call high-end real estate. But it's an important area, and it doesn't like to have things push on it. But it doesn't necessarily mean that it's a cancer. That would have to be determined by looking under a microscope with a piece of the tissue.
Thank you. Dr. Silva, let's see. What is the caller from Grand Rapids has a carcinoid tumor? What's that all about?
Yes, carcinoid tumors are tumors that arise from neuroendocrine cells that we see, and usually we see it in the GI tract, and it can happen in all sites of the intestines. And interestingly, because it's a tumor that arises from, it's like hormone-producing cells in your body. The tumor itself produces hormones that can cause symptoms such as flushing, diarrhea, vomiting, and cramping stomach pains. So things to watch for.
Is it a cancer?
It is a cancer.
It's a type of a cancer.
Yes.
Dr. Kebbekus, caller from Grand Rapids. Now, we talked about low platelet counts. Here's this lady has had high platelet counts for years. Is that a sign of cancer, or could that lead to leukemia?
Again, this has to be taken in the context of what do the other blood cell numbers look like. The fact that she's had high platelets for years and years, I'm suspecting it's a condition we call essential thrombocytosis, which is just a fancy way of saying high platelets. Risks from that can be clotting, having blood clots. If that platelet count is unchecked and gets to be extremely high, those patients can actually bleed. There is an increased leukemia risk, but it's small, and you wouldn't expect someone with that condition to go on and develop leukemia. But again, you need the whole context to know why the platelets are high.
Thank you. Dr. Onello, a caller from Carlton, wants to know, can muscles get cancer? Can you get cancer in the muscles? And why don't we hear more about that, he was wondering.
Yes, I think, as Dr. Kebbekus said, I think any tissue in the body can be the source or the site of a cancer. I think why we see more of one cancer than another would be a great discussion, but the term we use to describe a cancer that starts in a muscle, I believe, is sarcoma. Sarcomas are, I don't know why, but they're just not as common as other cancers.
They occur more in younger people?
It can, yeah.
Typically?
I do think of them
rather
occurring
than older
in younger
people.
people.
Our colleagues in pediatric oncology will treat more sarcomas than we do. In
Right.
adults, sarcoma makes up less than 2% of all adult cancers.
Sure.
And there's about 70 different kinds of sarcomas, so these are rare tumors.
Right.
Thank you. Well, we just have a couple of minutes left here. I'll ask Dr. Silva, a caller from Duluth would like to know palliative and hospice care. They want to know when you put the patients in hospice care. That's a really broad question, but you do, that is sometimes what the best treatment for people. Is that correct?
Yes. What we've noticed is that patients who, for example, palliative care is where you manage symptoms of pain, if they have nausea, those are the things that we manage. And when we manage those symptoms, patients feel better, and they tend to live longer than the ones who had these symptoms are not managed. And hospice care is where we tend to have patients when we know that further treatment is not going to benefit the patient. And at that point, our focus is comfort, make sure that the patient is comfortable, and also if they are able to be at home to have home hospice. I think that is our main goal, to try to have patients be close to family and spend the rest of the time that they have in a quality, with good quality of life, with better symptom management.
Well, thank you. That was very well put. Well, I came to the end of our hour, or half an hour. I'd like to thank our panelists, Dr. Ann Silva, Dr. Peter Kebbekus, and Dr. Emily Onello, and our medical students, Emma Sealing, Sarah Verding, and Cami Young. Please join Dr. Ruth Westra for a program next week on upper GI problems, when her panelists will be Dr. Daniel McKee, Dr. Jake Pernuski, and Dr. Aaron Thackeray. Thank you for watching, and good night.